Greetings to all. Today we will discuss about the dementia and its types. Dementia, it's a progressive decline in the various functions of cognitive, which encompassing the wide range of symptoms that includes impact in their memory, thinking, language and behavior. Unlike any other developmental condition, dementia includes very much deterioration from previously achieved cognitive abilities. When you compare dementia with delirium, dementia is quite more severe compared to that of delirium. And while the condition can manifest in various forms, it might fundamentally affect the ability to perform everyday tasks. That is, the major impact on the daily functioning can be observed when it comes for the dementia. Dementia is currently, according to the studies, it's a 7th leading cause of death among all the diseases and one of the major cause of disability and dependency among elderly people, according to WHO. And dementia has overall disturbances, like it disturbs physically, psychologically, socially, economically to an individual, and its effect is not only for the people who is living with dementia but also their caretakers. There is often always a lack of awareness and understanding of dementia happens, which will result in the stigmatization as well as barriers in the diagnosis as well as treatment of dementia. Dementia is collectively a syndrome where it usually has a very progressive as well as chronic nature, which will lead to the deterioration of various cognitive functions. That includes the thought disturbances will be seen, memory, thinking, orientation, comprehension, calculation, learning capacity, language, judgment. These are the major areas where the dementia gets affected. But one thing that we have to mainly focus here is consciousness is not affected, where you can differentiate clearly if the person is having any problem with consciousness, that means he is suffering from delirium, and if his consciousness is not affected, that means he might develop into dementia. And the impairment in cognitive function is commonly accompanied and occasionally preceded by the changes in other controls like emotional controls, mood disturbances, behavior as well as motivation. So, along with cognitive impairments, the other regions will also get affected. So, the physiologically to speak, degeneration of the cells due to brain injury or any other medical conditions are few of the factors that will contribute to the development of dementia. Now, coming to the clinical manifestations, the first thing we can observe is memory loss. So, difficulty remembering the recent events as well as names, conversations, and often it impacts to the daily functioning. And the second effect is on language. So, trouble finding with the words, speaking fluency will get disturbed, understanding the conversations, all other areas will get affected. And the major effect has also been seen with respect to reasoning as well as judgment. So, difficulty with respect to reasoning ability, that disturbs to the problem solving ability, making decisions and also managing the finances. And when it comes to behavior, it will be again personality shift will take place, irritability, agitation, depression, anxiety. These are all few symptoms that will be observed in a person who is suffering from dementia. And among the major types of dementia, dementia of Alzheimer's type is one of the major one. So, dementia of Alzheimer's type is the one condition which is also been why it is called dementia of Alzheimer's type, because the person who is suffering from Alzheimer's has all the risk to develop the dementia, where when the Alzheimer's symptoms are present in an individual along with the dementia symptoms, that is when we call it as dementia of Alzheimer's type. So, it is a progressive neurodegenerative disorder which will affect majorly on their memory, thinking and behavior, and it is most common cause of dementia, which will account for around 60 to 80% of the cases of the people who is suffering from dementia will often have this particular type of dementia. While exact cause of Alzheimer's disease is not known, but then significant progress will be made from the molecular basis, and biologically there will be lot of impairments found when the person is suffering from dementia of Alzheimer's type. So, in support of those things, there are also some genetic factors in Alzheimer's diseases which has been noted down. Firstly, the studies which has been conducted by the family history a significant portion of Alzheimer patients, for around 40% of the people, will exhibit the family history of the disease, suggesting a strong genetic influence. So, one of the cause for a person to develop Alzheimer's type of dementia is the family history. So, it is one of the genetically inherited condition. And even across the twin studies that's been found, it is said that genetics play a very major role. Especially the studies with respect to twin studies showed that monozygotic twins shows very higher concordance rate of Alzheimer disease when compared to that of dizygotic twins. And even in the other studies which is related to autosomal dominant inheritance, there also it's been found that very rare, but then some families have documented the case of Alzheimer disease transmitted through an autosomal dominant gene. In case any dominant gene has been transferred from one generation to another, then the person, if the person is suffering from Alzheimer's, then definitely the next generation will also get into Alzheimer's. And a few chromosomes that play very major role with respect to Alzheimer's disease here is, as per the research, the chromosome number 1, 14 and 21 are the three major chromosomes which plays major role when it comes to the Alzheimer's disease. Another important factor that will contribute towards this particular dementia of Alzheimer's type is amyloid precursor protein. So, APP is one of the protein which plays very important role, and APP, amyloid precursor protein gene, is present in the chromosome number 21. And it undergoes very differential splicing which results in the 4 distinct forms. And amyloid precursor protein, as it is present in the chromosome number 21, as we easily can associate when it comes to psychologists, when they name it as chromosome 21, trisomy 21 is the very oftenly associated condition, we call it as Down syndrome. So, the person, if he is suffering from amyloid precursor protein gene, if it is a carrier, and if the chromosome 21 gets affected, then definitely it will lead to the condition called Down syndrome. So, always Alzheimer's as well as Down syndrome are more oftenly associated with each other. And other proteins called beta A4 protein is also one of the protein which will lead to the condition called Alzheimer's disease. And coming to other types of dementia, of all these types, Alzheimer's is the major one where most of the cases get into. The other types includes vascular dementia. Vascular dementia is a type of dementia where blood vessels gets affected. Most people who are undergoing vascular dementia will lead to death because of the cardiovascular related diseases like heart related problems as well as strokes. These are few things, cardiac arrest are the few things that they will get into. So, vascular dementia is most often related to blood vessels. Then frontotemporal dementia is something to do with the temporal region of the brain, and Lewy body disease is where the type of dementia where the unwanted protein bodies gets dissected into the brain region, which will lead to the development of symptoms of dementia. Huntington and Parkinson, again to do with the involuntary movements. The person who is suffering from Huntington and Parkinson along with the dementia, then definitely they will have lot of motor disturbances. And HIV related is also one condition which might relate with the dementia, and then head trauma related dementia which will cause because of the head injuries. These are the different types of dementias which have been considered for the clinical diagnosis of dementia. Thank you.